Hello everyone. In this presentation, I will be talking about the HIV disease. We will be looking at a brief introduction about the disease, the symptoms and the ways it can be transmitted, as well as the impact and social issues about the disease. Acquired immunodeficiency syndrome, AIDS, is a chronic, potentially life-threatening condition caused by the human immunodeficiency virus, HIV. By damaging your immune system, HIV interferes with your body's ability to fight infection and diseases. HIV is a sexually transmitted infection, STI. It can also be spread by contact with infected blood or from mother to child during pregnancy, childbirth, or breastfeeding. Without medication, it may take years before HIV weakens your immune system to the point that you have AIDS. Although there is no cure for HIV/AIDS, medications can dramatically slow the progression of the disease. These drugs have reduced AIDS deaths in many developed nations. The HIV virus targets the immune system and weakens people's defense system against many infections and some types of cancer that people with healthy immune systems can easily fight off. As the virus destroys and impairs the function of immune cells, infected individuals gradually become more immunodeficient. The most advanced stage of HIV is acquired immunodeficiency syndrome, AIDS, which can take many years to develop if not treated, depending on the individuals. Now let's look at some symptoms of the disease. Within 2 to 3 weeks after infection with HIV, about two-thirds of people will have a flu-like illness. Some of the symptoms may include fever, chills, rash, night sweats, sore throat, fatigue, etc. These symptoms are of stage 1 or acute HIV. But people in the further stages, like stage 2 or chronic latency, may not feel sick or experience any of these symptoms. If left untreated, the HIV infection will eventually progress to AIDS disease, which is the final stage of the HIV infection. Some of the symptoms of AIDS include memory loss, a rapid weight loss, a recurring fever, extreme tiredness, sore throat, and genitals, etc. Now, let's look at some of the ways in which the disease can be transmitted. HIV can be transmitted via the exchange of a variety of body fluids from infected people, such as blood, breast milk, and genital secretions. HIV can also be transmitted from a mother to a baby during pregnancy, birth, or breastfeeding. However, it is less common because of advances in HIV prevention and treatment. This is called prenatal transmission or mother to child transmission. It is one of the most common ways that children get HIV. But if a mother with HIV takes her medication daily as prescribed throughout pregnancy and childbirth and gives medication to her baby for 4 to 6 weeks after childbirth, the risk of transmitting HIV to the baby can be less than 1%. People are also at risk for getting HIV if they share needles, syringes, or other drug injection equipment with someone who has the virus. Used needles, syringes, etc., may have someone else's blood on them, and blood can carry HIV. People who inject drugs are also at risk for getting HIV. They're also at risk for getting hepatitis B and C and other infections if you share needles, syringes, or other injection equipment. However, it is vital to understand that individuals cannot become infected through ordinary day to day contact, such as kissing, hugging, shaking hands, or sharing personal objects, food, or water. This image shows some ways in which HIV is not transmitted. Now, let's look at the impact of the disease. The disease has an impact on the individual as well as the economy and society. First, let's look at the psychological impact on an individual. The HIV positive diagnosis has a profound impact on an individual's psychological aspects of life, particularly interactions with others. Most of the people infected by the virus are lonely and have to cope with stigmatization and suffer disruption of family and peer relationships. They are confronted with prolonged uncertainty about their lives and experience intense, constant fear of disclosure of their disease and of being rejected by society. Yet, they're not always able to discuss these fears and anxieties openly with friends or family. The impact of HIV treatment is further aggravated by other factors such as worry about employment, sexuality, the prospects of relationships, and the social reactions of other community members. Another impact of HIV is the stigma and discrimination against persons living with the disease. Apart from having to endure treatment with severe side effects, they constantly have to cope with rejection and social discrimination. People with HIV/AIDS have to put up with being labeled as victims, a term that implies defeat, helplessness, and dependence upon help from others. Next, let's look at the economic impact. HIV/AIDS has had the greatest negative effect on economies of many countries all over the world. The magnitude of economic and demographic impact of HIV/AIDS infection in third world countries is particularly pronounced due to the fact it affects persons in the most economically able and productive age. Sub-Saharan Africa is the most affected, with Southern Africa leading with the effects of the virus. The World Bank approximation shows that the GDP of South Africa reduced by 20% in 2010 due to the effects of the deadly virus. Many other countries are using a huge proportion of their economic resources in providing treatment and care for people with HIV/AIDS. The economic impact is severe poverty, a reduction in investments and savings, and rise of employment in many industries such as agriculture and manufacturing. In sub-Saharan Africa, where the infection has become highly prevalent, it is leading to great suffering and worsening poverty. The capacity of these patients to work for their usual sources of income generation is lost. Incomes lost due to the stigma of the disease must be met by the sufferers by over-exploiting their resource base. In Africa, this has led to the degradation of the ecosystem, overuse of medicinal plants, and poaching for wildlife. The economic impact of HIV is also greatly felt by the individual and their families. HIV/AIDS in many cases results in loss of income of the breadwinners and increase in expenditures as a result of caring for the infected. Families affected by HIV deplete their savings and assets in order to cope with the increased expenditure and income shocks. And now finally let's look at the impact on caregivers and healthcare sector. The major burden of caring for people with AIDS rests with the family and the healthcare providers. In the era before antiretroviral therapy, this used to be an immensely stressing task because most of the times the health of the infected patients deteriorated rapidly and they were bedridden and had to be taken care of. The major impact of HIV on the caregivers is stigma, usually referred to as secondary stigma or stigma by association. Parents of people living with HIV may be held responsible for the immoral behavior that led to the infection of their children with HIV. Caregivers of HIV infected children also face stigma. Studies report that increased financial difficulties, problems in childcare and support, and compromised help seeking due to stigma. These findings emphasize the need to develop interventions to enable caregivers to seek out and identify financial resources and childcare to support and empower caregivers to deal with stigma. Healthcare providers also may fear stigmatization in their work with HIV patients. This stigma may influence their willingness to work with those with HIV/AIDS or makes their work more difficult. There are many social issues associated with HIV/AIDS. Let's look at a few of them. Firstly, key affected populations, HIV and AIDS. People who belong to the key affected populations are people who, for one reason or another, are more vulnerable to HIV infection. This could be because they engage in high risk behavior, such as in injecting drugs, or because they're marginalized by society and fearful of accessing HIV services. Some key facts include homosexual acts are illegal in more than a third of the countries, preventing queer men from accessing HIV services. 14% of all people who inject drugs are living with HIV. People who inject drugs are repeatedly denied access to harm reduction programs. Incarceration decreases HIV vulnerability, especially when prisoners engage in high risk behaviors like injecting drugs. Being transgender is strongly associated with stigma and discrimination. Transgender people also lack access to tailored HIV services. Next, HIV stigma and discrimination. HIV related stigma and discrimination refers to prejudice, negative attitudes, and abuse directed at people living with HIV and AIDS. In 35% of countries with available data, over 50% of people report having discriminatory attitudes towards people living with HIV. Stigma and discrimination also makes people vulnerable to HIV. Those most at risk to HIV continue to face stigma and discrimination based on their actual or perceived health status, race, socioeconomic status, age, sexual orientation, or gender identity, etc. Next, let's look at homophobia and HIV. Homophobia continues to be a major barrier to ending the global AIDS epidemic. The global HIV epidemic has always been closely linked with negative attitudes towards LGBT people, especially queer men, a group that is particularly affected by the disease. At the beginning of the epidemic, in many countries, gay or queer men were frequently singled out for abuse as they were seen to be responsible for the transmission of HIV. Sensational reporting in the press, which became increasingly homophobic, fueled this view. LGBT people face specific challenges and barriers, including violence, human rights violations, stigma, and discrimination. Criminalization of same sex relationships feeds into social homophobia. Everyday instances of discrimination, and both factors prevent LGBT people from accessing vital HIV prevention, testing, and treatment and care services. As a result, some LGBT people are unknowingly living with HIV or being diagnosed late when HIV is harder to treat. Finally, let's look at gender inequality and HIV. Women and young girls continue to be disproportionately affected by HIV around the world, but particularly in sub Saharan Africa. Gender inequalities include gender based and intimate partner violence, exacerbate women and girls' physiological vulnerability to HIV, and block their access to HIV services. HIV is not only driven by gender inequality, but it also entrenches gender inequality, leaving women more vulnerable to through its impact. HIV disproportionately affects women and adolescent girls because of their unequal cultural, social, and economic status in society. This means that gender inequality must be tackled in order to end the global HIV epidemic and achieve other broader development outcomes. Stigma and discrimination further exacerbate women's vulnerability to HIV and undermine the response to the epidemic. In particular, women in key populations face numerous and specific challenges and barriers, including violence and violations of their human rights in healthcare settings and from ununiformed personnel. From the above presentation, it is obvious that there are a lot of issues surrounding HIV/AIDS other than the disease itself. There is a problem of misinformation and lack of awareness, not only in India but worldwide. Stigmatization and lack of acceptance by friends and family keep many people quiet about their illness and experience. This lack of awareness leads to bigger problems like lack of employment, healthcare, etc., which further alienates people living with HIV/AIDS. It is important to understand that it is an illness like any other and be supportive and helpful. Thank you.